Peripheral neuropathy refers to any condition that affects the nerves outside your brain or spinal cord. This can happen for several reasons, from trauma to infections to inherited conditions. There are also many possible symptoms. Many causes, forms or symptoms of this condition are treatable, but this can vary widely from person to person. Peripheral neuropathy, when your nerves start whispering the wrong messages. Imagine the electrical wiring in your house. Now, imagine what happens if the wires get frayed or damaged, lights flicker, appliances malfunction, and strange things happen. That's exactly what peripheral neuropathy is, a fault in the wiring of your body. What is peripheral neuropathy? Peripheral neuropathy is a disorder of the peripheral nerves, the vast network that connects your brain and spinal cord, the central nervous system, to the rest of your body. These nerves carry messages that control movement, feeling, digestion, and more. When these nerves are damaged, the messages get garbled, delayed, or blocked completely. The result? Numbness, tingling, pain, weakness, and more. Causes: what damages the nerves? Peripheral neuropathy isn't a disease itself, it's a symptom of something else. Here's what can go wrong. 1. Diabetes. Most common, high blood sugar damages blood vessels that nourish nerves. 2. Infections like HIV, leprosy, shingles, Lyme disease. 3. Alcohol abuse. Alcohol is toxic to nerves and depletes nutrients like vitamin B1. 4. Nutritional deficiencies, especially B vitamins, B1, B6, B12. 5. Medications and toxins, chemotherapy drugs, heavy metals, even some antibiotics. 6. Autoimmune diseases like lupus, Guillain-Barré syndrome, rheumatoid arthritis. 7. Trauma or compression, car accidents, herniated discs, repetitive motion, carpal tunnel. 8. Genetics, hereditary neuropathies like Charcot-Marie-Tooth disease. Types of peripheral neuropathy. There are 3 main types, depending on which nerves are affected. 1. Sensory neuropathy. Numbness, tingling, burning, electric shock sensations. Can cause loss of balance, especially in the dark. 2. Motor neuropathy. Muscle weakness, cramps, twitching, difficulty walking or lifting objects. 3. Autonomic neuropathy. Affects involuntary functions, blood pressure drops, sweating abnormalities, bladder, bowel issues, digestive problems. Sometimes all 3 can occur together, called mixed neuropathy. Symptoms: what does it feel like? Tingling or pins and needles. Burning or sharp stabbing pain. Numbness, especially in hands and feet. Muscle weakness or paralysis. Increased sensitivity to touch. Feeling like you're wearing socks or gloves when you're not. Heat intolerance or dizziness. Difficulty digesting food, urinating, or sexual dysfunction. Symptoms often start in the feet or hands, then spread up the limbs. This is known as a stocking glove pattern. Diagnosis: how is it found? Doctors don't guess, they test. Here's how. When to see a doctor. If you experience progressive weakness or pain, loss of coordination or falling frequently, bladder or bowel dysfunction, unexplained weight loss, sudden onset of symptoms, seek medical help early. The earlier neuropathy is diagnosed, the better the outcome. Can it be prevented? Absolutely. Start with these. Control blood sugar for diabetics. Eat well, plenty of fruits, vegetables, whole grains, and lean protein. Avoid toxins including alcohol and harmful medications. Take care of your feet, especially if you have diabetes. Exercise regularly, it promotes circulation and nerve healing. Fascinating facts. There are over 100 types of peripheral neuropathy. Diabetic neuropathy affects over 50% of people with long-standing diabetes. Neuropathy can cause phantom sensations, like bugs crawling on your skin. In some cases, nerves can regenerate, but it takes time, months to years. Your nervous system has 2 parts: the central nervous system and the peripheral nervous system. Your brain and spinal cord are the 2 components that make up your central nervous system. Your peripheral nervous system consists of all the other nerves in your body. It also includes nerves that travel from your spinal cord and brain to supply your face and the rest of your body. Peripheral neuropathy can affect anyone, regardless of age, sex, race, or ethnicity, personal circumstances, medical history, etc. However, some people are at greater risk for specific types of peripheral neuropathy. Summary: key takeaways. White heavy checkmark peripheral neuropathy is nerve damage affecting sensation, movement, or body functions. White heavy checkmark: it's a symptom, not a disease, so find the cause. White heavy checkmark treatment focuses on fixing the root cause and managing symptoms. White heavy checkmark prevention is powerful, especially with diabetes, nutrition, and healthy habits. White heavy checkmark early detection means better healing, less pain, and fewer complications.
If you find this video helpful, like, subscribe or follow My Health by Dr. J for more important health videos.